This is Far Eastern University in Manila, and let's talk about a common respiratory disease in the Philippines, asthma. Over 12 million Filipinos live with asthma, including students here in FU. It's not just about shortness of breath, it's more than that. On bad days, it feels like breathing through a storm, with every step feeling heavier than before. Let's go microscope. This is a normal bronchus, and this is an asthmatic bronchus. You'll see thickened basement membranes, goblet cell hyperplasia, meaning excess mucus production, hypertrophic smooth muscles that squeeze your airways tight, and infiltration of inflammatory cells like eosinophils. It's not just tight nerves, it's structural change. That's why asthma isn't just something you get over. Attacks can be triggered by stress, dust, and pollution, even the Manila air that creeps into the campus. All it takes is one unfiltered environment or a slip of paper, and suddenly it's hard to give up. I had to rush to the FBT more than once just to breathe again. But thankfully, up your heads, students learn how to manage asthma with education, treatment, and support. We learn how to use big flow meters and recognize early warnings instinctively. Inhalers, trigger control, and early diagnosis, they help us take lives. And they help us stay in class, not in the ER. It's not just about breathing faster, it's about preventing cleaner air, greener spaces, and less pollution. That starts with awareness, that starts with us. Every tree planted and every anti-smoking rule followed, it all adds. Asthma doesn't have to hold us. With the right tools and supportive environment, we can thrive even under pressure. Asthma might be invisible, but with science, care, and community, we can make it manageable. One breath at a time. That's 1 minute of histology. See you tomorrow. I'm not a doctor, but today, let's talk about something that is bothering almost millions of women, which is polycystic ovary syndrome, or also known as PCOS. PCOS is a hormonal disorder. It can cause irregular periods, acne, weight gain, and even infertility. Some of us don't even know we have it until symptoms piled up. Sometimes it starts with just one missed period, then two, and soon, whole cycle is messed up. Now let's talk about something that is happening inside the body. Under a microscope, a normal ovary has follicles developing at different stages. But with PCOS, you see a thickened ovarian stroma, mainly immature follicles, line up like a string of pearls. It's called follicular arrest. They don't fully mature, and that disrupts ovulation. This isn't just a visual change. It reflects deeper hormonal imbalances involving androgens and insulin resistance. And PCOS isn't just about ovaries. It affects metabolism, insulin levels, and mental health too. Some of us deal with fatigue, anxiety, or sugar cravings. We don't always connect to hormones. That's why lifestyle plays a big role. Food, sleep, movement, it all matters. Small changes like regular walks, mindful meals, and staying hydrated can fully help. At home, we can't always get to a doctor fast, but we can track our cycles, ask questions, and advocate for ourselves. There's no period, but there is much. With the right support, it's possible to feel better, more stronger, and in control. PCOS is tough, but knowledge makes it easier to face. This is what real health awareness looks like from home, from the heart. That's 1 minute of histology. See you tomorrow.